This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Welcome to Living Healthy. I'm executive producer Jacqueline Bonfiglio-Naja, and I've been hosting this month's show about holistic breast health. We at Living Healthy feel strongly about the steps people should take to educate themselves about cancer and its early detection and prevention. We therefore have as our guest one of the most knowledgeable breast health practitioners in New England, our own Jackie Bell. Welcome, Jackie Bell.
Thank you.
Now, Jackie, I know you personally, and I know you're a natural medicine consultant. And I also know for the past decade, you've been really educating women about holistic breast health to empower themselves about making the right health choice for themselves. So I know we have a full-packed interview here, and we have a lot of great information to share. So want to get started?
Yeah, definitely.
Great. So, okay, the question. What is the difference between mammography and thermography?
Mammography is a device that takes a picture of the anatomy of the breast in order to detect if the breast tissue has already changed, if there's a tumor there, if there's a strange density, which could be a tumor, a cyst, a scar, anything like that. And so that's the way that we are using to get checkups for our breast health. Now, thermography is a way to do the same thing, but it uses our body temperature and our heat. And the main difference is that mammography takes a picture of your breast, and so it's considered an anatomical. We're trying to take a picture of your anatomy, whereas thermography, we're looking at the physiology of the breast. We're looking at the circulation of the blood and the heat and the nervous system. So we're looking to see the functioning health of the breast tissue. Also, mammograms are done with X-ray technology, which is very toxic. And 75% of all breast cancer in the United States is caused by medical radiation. So in order to get that picture of the breast, they use X-rays, which that radiation can accumulate in your body and cause problems later on. Thermography doesn't put anything into your body. It's completely non-toxic and non-invasive. So the main thing to walk away with the difference between mammography and thermography is that one's taking an anatomical picture and the other is looking at the physiology, the functioning health of the body.
So mammograms is considered the gold standard for breast health. So where does thermography fit in? Well,
mammograms are considered the gold standard for early detection. I really think that there's been more and more studies coming out that have shown that as far as an annual screening for breast health, it's starting to really lose its hold as a gold standard. Now, thermography, and we'll talk a little bit about that because that's really important information. Now, thermography is not considered by the medical community, the orthodox medical community, as being a frontline screening. It is approved by the FDA as an adjunctive screening to mammograms, and being adjunctive means that you use it in addition to, that it's going to give you more information than you can get if you just had a mammogram. So whereas mammogram is considered by most doctors as the way to go to have an annual screening, even though it's best used just for detection, thermography is an adjunct to that and is not to be used as a standalone diagnostic.
There are recent controversies about using mammography for annual checkups. Can you explain to us why, the controversy?
Yeah. Back in 2006, the American College of Physicians did a study. Now, it's important to note that the American College of Physicians is the second largest medical association in the United States, the first being the American Medical Association. So the American College of Physicians did a study in 2006 analyzing how helpful mammograms have been over the past 10 years. And what they came out with was a lot of concern. They're concerned especially about the mammograms that are done from from the age of 40 to 50. When a woman is still menstruating, she hasn't gone into menopause yet, she's still active and can still have a child. And what they found was that, especially during that age group, that too many false positives were being found with mammograms, and that was leading to too many procedures that were unnecessary. And we know that 85% of all biopsies are benign, and although that's fantastic that all those biopsies are benign, that means that we're doing a lot of unnecessary biopsies. And so women who are being diagnosed with, some kind of lump or some kind of cancer are then, or if there's a density in the breast, say from a mammogram, they then do further testing, which may go ahead and diagnose some kind of cancer, or it may be benign, but it's a lot of testing that's unnecessary when the same kind of information can be found from examination. So this is causing not only an unnecessary amount of testing and treatment, but they're also finding a lot of DCIS, which is ductal carcinoma in situ, and 98% of DCIS can go untreated. It won't harm your health, it won't affect the quality of your health, and it won't shorten your lifespan. In other words, that type of cancer usually doesn't change, it doesn't get worse. And so we're going ahead and finding that and treating it unnecessarily when a woman would have been fine if it had just been left alone. So that's the main concern. And then in Europe there's a controversy too, in Norway and in Britain, and it's not worth mentioning the statistics because there's actually a debate going on about it. But the fact that in Britain, where women are not recommended to have mammograms until the age of 50, and then they have them every 3 years, they are still wondering if that is too many mammograms, if mammograms are still effective at that stage of life. And the last thing is that in 2002, the United States Preventative Services Task Force, which is our country's task force that determines how often you should have screenings for prevention. And in 2002, they stated that starting at the age of 40, women should have a mammogram every year for prevention, for early detection for breast cancer. Now in 2009, because of review of these studies that the American College of Physicians have put out, as of November 2009, the official stance for the United States Preventative Services Task Force is starting at the age of 50, a woman should have a mammogram every 2 years if she's not in a high-risk category.
So Jackie, let me ask you about that point about the task force. So are the medical physicians now warning that? Are they honoring that statistic that they said? Or what is the heartbeat right now that's going on in the medical profession about that?
Well, I think that there's a lot of controversy in the medical profession, to be honest with you. And most primary care physicians who aren't specialized in breast health and most gynecologists still are recommending annual mammograms, so that if you said to the doctor, oh, I don't want to start till I'm 50 and I want to have it every 2 years, you might come up against some controversy with your doctor. Most doctors now are still standing to the annual mammogram. Today a client told me that her daughter was told to have one starting at the age of 30 because her aunt died of breast cancer. And that is really too young. The breasts are far too dense at that time to be able to have some accurate determination using a mammogram. So I think that it's going to take a while for the doctors to come around. Some doctors are better read than other doctors, and then there's also, the finances in the political arena of running a large business where you're doing mammograms. They have to pay for the equipment and so forth. So it's not, if they don't have to give it up, they're not going to. And I really think too, part of it will be, it's the best thing until we find something else.
Now, we do have our mammography, we do have our mammograms, but there's still a high breast cancer rate. So why is the reason why you think that, Jackie?
Yeah, and this is, really my own opinion on this after seeing so many clients over the past 10 years. First of all, mammogram is supposed to be early detection when actually it's not. It's well known and well documented by the American Cancer Society, for the National Cancer Institute, that once a mammogram detects a lump in your breast, you've already had the disease for 6 to 10 years. And in Europe, they say it's up to 20 years. And even when it's palpated and they find it with an examination, you've had it for about 8 to 10 years. So to me, that's not early detection. You know, early detection is before the disease, before you actually get the disease. So that means that the disease process has already been in your system for a long time. The other thing is that when we regard breast health and we're looking for breast disease, we only look at the breasts. And a lot of breast disease is actually the cause of other things that are going on in the body. So the mammogram only looks at the breast, and it only wants to treat the breast and continue down that line. When I think that if we look at the underlying causes and the risk factors involved with breast cancer, that we would agree that breast cancer is a whole body disease. It's not just about the breast, it's about your hormones, it's about your toxicity, it's about infection, and so forth. So I think it's really important to look at the whole body and also to take preventative measures. Whereas mammogram, you go and you have your mammogram. You know, if you're fortunate and you have a good screening, the doctor sends you home but doesn't tell you anything to do to stay healthy. You go to the dentist, you have a good checkup, and the dentist and the hygienist are going to make sure that you're brushing and flossing your teeth, you know, once a day, twice a day, and to clean the areas that you've neglected. So I think that if we take that preventative measure of knowing what we can do to stay healthy, that we would have far better statistics than we do now. So that's why I think mammograms doesn't cover the gamut. It's too narrow.
So I know I met you 10 years ago, and you talked about thermography. And it did take me 4 years to have mine done. So tell us about thermography.
Well, there's actually two kinds of thermography, so that we need to be clear on that. One is the digital infrared imaging camera, and that is really the most popular type of thermography. And that uses a camera to take an image of the heat radiating off the body, and that's basically layman terms of describing what happens. But you get a picture, and it's all color-coded according to the most heat in the body and the most cool temperatures. And what they do is they, look at the breast, and they look to see if there's an inflammatory condition there. The thermography that I do is different from that. What I do it was developed in Germany over 30 years, and it's called contact thermography, and it's also called computerized regulation thermography, and I just call it European thermography to designate that this is the one from Germany. And what I do is I use a temperature sensor to gently touch the skin and take a temperature reading at over 100 points on the body. And then what we do is we're getting temperature readings so that we can see if there's an inflammatory condition, which you want to know because inflammatory breast cancer is the most dangerous kind. And also, the reason why thermography is so helpful for breast health is that when a tumor is first developing, it requires a lot of blood, and that's going to be warm. So we're going to start to see heat in one breast as opposed to the other one. But we can do all that with the European thermography, just like the digital imaging, and that's where the digital imaging stops. All it can tell is if there's heat or not. With the European thermography, we're looking at the nervous system's response to change the temperature of the skin. So we know that the underlying organs influence that nervous system response. And every place that I touch on the skin is connected to an underlying organ, a gland, or lymph through the nervous system and the capillaries. So the points that I touch on the body with the temperature sensor have to do with the sinuses, the lymphatic system, the tonsils, all the teeth. We look at the lungs, the heart. We look at, of course, the breast tissue. We do a lot on the breast. For men, we look at the prostate. We look at all the digestive organs like the liver, the stomach, the gallbladder, the large intestine, small intestine, kidneys. So we're able to look at the health of the breast, the functioning health of the breast, the physiology. Can't diagnose and say, oh, this looks like, breast cancer. But we know that when breast cancer occurs in the body, that the nervous system is going to behave a certain way when it comes to cooling the skin. And so we can have a suspicion that, gee, it looks like there's a suspicion that a tumor is forming, looks like an inflammatory breast case or fibrocystic. So we get a lot of information because we're looking at the breast, but we're looking at them in context of the whole body. So just like I said, it's not just about the breast, it's about the hormones, it's about infections. So we're going to look at the immune system, we're going to look at the toxicity, we're going to look at the ovaries and uterus, the pituitary and thyroid, the liver. All those things are important in understanding the breast health.
It's all connected.
Yeah, I'll give you a quick example too. I have a client who was diagnosed with invasive ductal carcinoma, and she had a little biopsy, so that's how the diagnosis happened. That's the only way you can diagnose breast cancer. And when I did the thermography on her, really the functioning health of the breast was fine. But when I looked at the rest of the body, I could see that she had a lot of distress in the colon. And in fact, I just had another client today, the exact same thing. Inflammatory situation in the colon, plus some other things. So this one client, when she treated her colon and she did it holistically for 3 years, the diagnosis of her breast cancer totally cleared up because they could see that there were cancer cells in her blood with an AMAS test. And so having used that test throughout the years, after 3 years she was completely cancer-free just by working on her digestion and the health of her colon. So,
amazing.
Yeah.
It really is. I mean, you must get very excited and feel very rewarded when with thermography. I know that I feel personally you were on the forefront. I mean, no one even knew what thermography was. So what kept you keep on the forefront, pioneering, because you're really passionate about this and you really want women to make the right choices and really empower themselves.
Yeah.
Regarding that, especially with me, I'm also a practitioner, but I'm also a patient of yours. And from my own personal experience, you don't mind me saying, little testimony here, is that in 2004, when I saw you, I said to you, this is probably the worst health I will ever be in, because this is the day I'm going to make the change. And that's a huge commitment when you make that to yourself. And I know personally, from having European thermography, it really did change my medical track, my medical course, because that first time I was borderline.
Yeah.
So I knew if I didn't change my path,
Right.
that there's going to be some issues down the road. And it was very rewarding to see. And I also, did my mammograms for a couple of years and did the thermography as I was working towards my own personal medical journey with this all. And when I had it in 2007, it was healthy.
Yeah.
So that was like, yay! So it's very rewarding, not just for yourself, but for your patient to really make that commitment and really empower themselves for making that choice.
Yeah, I think that's very well said. And most people have, their breast health is fine. But we do see on the reports, well, gee, your breast health is fine, looks great, but what's going on with your liver? Or your lymphatic system is really congested, or you have an underlying infection somewhere, and maybe in your tonsils, appendix, or in the teeth, maybe in the dental area, it needs some cleaning up. And those are things that you can do for your own personal journey on staying healthy. Is, I don't need to see you for another year for your checkup, but during that time, here's a couple people that you can go see for lymphatic health and, nutrition, or, and to take care of some of the other symptoms that you have that could inadvertently pile up over the years and affect your breast health.
So European thermography is FDA approved.
Yes.
It's insurance coded.
Yes, there are insurance codes for it.
Now, do you feel that a lot of people, because it's insurance coded, might have the opportunity to experience thermography and maybe change their path in doing a mammogram over thermography with thermography?
Yeah, I think that a lot of people choose what medical route they're going to take according to what their insurance covers. So I would encourage people to, try the holistic approach and really be able to nail down a path on what you need to be doing specifically. And that way, if you do that in addition to the mammograms, that way you can see both worlds, and then, you know, and then start to get the feel of everything. And I think it's really important. I want to just mention that in 2007, the World Cancer Research Fund, which is based in Europe and is very well supported by our American Cancer Research Institute here in the United States, they did a study of 12 different kinds of cancers in 4 different countries. And the countries are the United States, Britain, China, and Brazil. And they looked at how these 12 different types of cancer could be prevented just with diet, exercise, and weight loss. And so when they finished their study, you go down and you could see that breast cancer in the United States, 38% of all breast cancer could be prevented with diet, exercise, and weight loss. So just with nutrition and lifestyle, over 1/3 of all breast cancer cases could be prevented, like not even happen. So I'm saying that's a beautiful thing. Let's lay that foundation with nutrition and lifestyle, you know, and then give every single woman a personal individual program, which Thermography can help with.
Exactly.
Your program is different than my program, and so we give you an individualized program. I think that percentage could be far higher, and that I think is where the world trend is going in breast health.
I believe that too. More and more, because I really feel that individually more people are taking a stand with more of a stand according to their health choices.
Yeah, I do too. I mean, more people want to eat locally, organic food. They're, you know, we're recycling. We're buying more efficient cars. We're just being more conscious of what we're doing to our bodies. So I think that if people were more aware of some of the underlying risks of that cause breast cancer too, and that's part of what I try to teach women, is what are the main things that I can avoid so that I don't have to worry about breast cancer. So the main things would be, of course, low-grade chronic infection. If you have an infection that's been going on for a long time, some of us are unaware of it, you know, but if you've had long-term sinus infections or long-term irritable bowel, or even a lot of us have infections in at root canal places, the tips of root canal, because we can't feel the pain of an infection there. So if we had an abscess and it went into a root canal, there could still be an infection there. And a lot of us have low-grade infections in our lungs even. We might tend towards bronchitis or something like that. Those need to be dealt with. Even something like Lyme, especially if it's a viral infection, that needs to be dealt with. Those are going to be better dealt with if we deal with the toxicity issues in our body. So if we're becoming so toxic from environmental pollutants, maybe occupational, maybe heavy metals from our mouth, maybe we're drinking water from, you know, a bad source, maybe, you know, dirty pipes or something like that when we grew up. There's many different reasons where we could have toxicity levels, and some of us hold on to toxins more than others as well, just the natural way we are. So the toxicity level is very important. And then also the hormone imbalance. You know, doing a simple saliva test for your hormones and then taking nutritional supplements at first can help to offset hormonal problems later. And then the last thing, of course, is emotional trauma and stress. That always plays an underlying role in any kind of chronic disease, and especially with breast health. So I like to go through all the different factors of, you know, like, you know, for you as a client, what you might have been exposed to when I look at your history. You know, if you have a history of bronchitis and pneumonia treated with antibiotics, and then getting Epstein-Barr or Lyme, and then having uterine fibroids and this and that, you know, root canals that have been infected and so forth. That's just, you know, Pandora's box of trouble later on, whether occurs as breast cancer or something else. And so if we start to take away and start to really effectively deal with those things in an integrative perspective, because something in the lungs might offset something, might offset your colon, just because in Chinese medicine the lungs and the colon are a paired organ. So, people just, if you can pull the integrative approach together and people can be made aware of this integrative approach and incorporate that with a lifestyle, you start feeling better, you start acting better, you start, loving better and
living your life.
Yeah, living your life.
And happy.
Yeah.
Absolutely. Let me ask you one question here. You did talk a little bit about when you do the thermography and you do the points in the mouth. Now, what is the reason why you do that?
The points around the mouth there? Yeah, it's because we do all the teeth. Every tooth is considered an organ in Europe because it has a nervous system and blood supply. So the health of the teeth is considered a very big part of the health of your whole body for a couple reasons. One is that an infection here, or having metal in your teeth, metal top and bottom, you get a galvanicity going. Having an infection, that gets into your lymphatic system, it can affect your sinuses, and it affects your overall immune system health, meaning that you're dragging a ball and chain. You've got this low-grade infection in your mouth. So we want to analyze that with the thermography. Also, sometimes we have extra tension in our jaw. Like I'll say, gee, what's going on the left side of your mouth? People have beautiful teeth, no teeth issues at all, and I'll say, do you grind? Do you grind or clench your teeth? Because that grinding and clenching here can affect C1 and C2 in your neck, which can affect the tension in your throat, which can affect your thyroid, which can affect your hormone system. And so, everything plays together. So we like to consider the teeth as part of one of the organs, even though not a major organ, but as far as, organs in your body.
Wow. Believe it or not, Jackie, we are winding down this program, and I'm sure you have so much more information we could share. If you'd like to learn more about European thermography, you can visit Jackie Bell on the web at naturalbell.com. I'm Jacqueline Bonfiglio-Naja, and you've been watching Living Healthy. Thank you for watching.